Hi, my name is Akash Patel. I'm a consultant trauma and orthopedic surgeon. I work at the Royal Free London NHS Trust, and I'm the associate professor at UCL. So, the question we have been asked is about hip arthroscopy. So, what is hip arthroscopy? So, this is minimally invasive keyhole surgery that involves putting a camera into the hip using one or two small cuts. Usually we make at least two cuts and sometimes a third one to take a look inside and to treat any potential problems. Now, why do patients have hip arthroscopies, or why would they require hip arthroscopies? So there are lots of different indications, but one of the commonest ones is something called hip impingement. So hip impingement essentially involves abnormal contact between the ball and the socket. And there are different components to hip impingement. Patients have a bump of bone around the ball of the hip joint, and that bump of bone can be called a cam lesion. This bump of bone can then knock up against the socket, against something called a pincer lesion, and this can cause pain around the hip. Along with these two components, patients sometimes have labral tears. The labrum is a piece of tissue around the socket which helps to hold the ball of the hip joint in. And the reason to have a hip arthroscopy is because of the symptoms. Symptoms of this include pain, clicking, catching, discomfort on all different types of movements, especially flexing the hip up. Sometimes they have a clunking sensation around the hip, and usually this occurs in younger patients. Patients can also have issues with the rotation or the way that their ball and socket and the hip joints are formed. Then, what the operation involves is key. So, patients usually come in to the hospital. They have anesthetic assessment. Anesthetist has a discussion. They have a general anesthetic usually. They're put on something called a traction table. We look at the hip under x-ray guidance. We make some cuts around the hip, put the cameras inside. The extra bits of bone which cause impingement, we usually remove them, so we shave off the bits of bone. The labrum, which is the piece of tissue around the socket, we most commonly try to repair this because we know patients who have labral repairs do much better than something called debridement, which is removing the cartilage around the socket. After patients have this operation, which can take a couple of hours, they have a few stitches in. These come out at the 2-week period approximately. The key component for recovery is also the rehabilitation. So walking, physio, stretching, gentle movements, very, very important. It can take 6 to 12 weeks for things to settle down. So hip impingement is another important thing to talk about because, of course, hip arthroscopy is a surgical treatment option, but we always suggest to our patients to try non-operative treatments first. And these include physiotherapy, activity modification, painkillers, and usually patients have injections. The other thing patients ask about is what's the process? What happens before any of this? So we undertake a history, we ask patients questions, we examine their hips, and then we undertake scans, such as MRI scans, to give us more detail about what the problem is. And then we have a balanced discussion with patients about risks and benefits. The benefits are improving symptoms. The risks include bleeding, infection, swelling, damage to the blood vessels, nerves, pain, anesthetic risks, blood clots, stiffness around the hip, and usually patients do well if the surgery is done with for the right problem in the right hands, but the rehab is also extremely key.